RightOpt is a service. It's part of Xerox Corporation, and it's a service to Savannah River retirees to help them with Medicare, basically. So we'll talk to retirees about Medicare Parts A and B. We'll talk about the supplemental plans, including prescription drug plans, dental and vision. So we help retirees go through the Medicare process and talk about the supplemental plans that are available. In addition to working with retirees on the plans that are available, we'll also complete enrollments with them. So once they decide on what plans they're interested in, we'll complete the enrollment over the phone, online. The retirees can follow us online if they're comfortable with a computer, and we'll work with them in completing the enrollment. Then once the individual's enrolled, RightOpt doesn't go away. We're there year-round to help them with any of their insurance questions, or if they have questions about their HRA, how do they file claims to collect their Savannah River stipend. Through RightOpt, you're getting somebody who's been trained in the Medicare area. We call them advocates. So when you contact RightOpt, you'll be working with an advocate who knows Medicare and can help you with the Medicare enrollment process. Secondly, as part of our services, we'll talk about the different types of plans available to supplement Medicare. So Medicare supplements, Medicare Advantage, prescription drug plans. We also offer dental and vision plans. We will take you through all those plans. We'll take you through the enrollment process, and then once you enroll in a plan through RightOpt, we're there to help you year-round. So if you have questions about your plan, your benefits, your HRA with WageWorks, we're there to help you throughout the year. Another thing to remember is that in order to get the Savannah River stipend, you have to complete your initial medical enrollment through RightOpt. So once you do that, then you're eligible for the stipend through the WageWorks HRA. What RightOpt needs from the retiree is, during our initial conversation with you, as we start to talk about the types of plans available, we'll ask you questions about the prescription drugs that you're taking. That's really important in finding the right prescription drug plan for you. So as you prepare for your conversation with a RightOpt advocate, you should list all of the prescriptions that you're taking. We'll go through those during the plan comparison phase. The other thing that we'll need from you is information about your health. So we'll ask you a general question about how is your health, good, fair, poor. The reason we do that is it has nothing to do with the enrollment process or underwriting. What we want to do is help you estimate your total out-of-pocket costs. And the best way to do that is to get an understanding of your health condition. So that's a question that a RightOpt advocate will ask you as we start to talk about the plans. Other than that, you really don't need anything other than to be enrolled in Medicare Parts A and B, and we'll confirm that also during our conversation with you. After enrollment, RightOpt does not go away. So we'll complete the enrollment with you, and then we're available throughout the year to help you with any questions that you have. So if you have questions about the plans that you've enrolled in, the benefits under those plans, if you have questions about your WageWorks HRA, all you have to do is call RightOpt, and one of our advocates will help you with those kinds of issues. We're also available during the annual enrollment period, during the Medicare annual enrollment period, to help you reevaluate your plans. So if the plans you enrolled in don't seem to be working for you, you want to see what other plans are available, you want to recheck your prescription plans to see if anything there has changed, RightOpt is available in the fall to talk to you about the options available for the upcoming year. The difference between Medicare Advantage and Medigap, they both provide supplemental Medicare coverage. The difference being a Medicare Advantage plan contains Medicare Part A and Part B. Usually Medicare Advantage plans provide additional benefits. So for example, some of them offer health club benefits. Some Medicare Advantage plans also offer prescription drug. So you might hear about Medicare Advantage, which doesn't have prescription drug coverage, or Medicare Advantage with prescription drug coverage. And we'll talk to retirees about those options and the differences between the two. The thing to remember about Medicare Advantage plans is they usually operate in networks. So if you sign up for a Medicare Advantage plan, you'll have to make sure that the doctors that you go to or that you want to go to are in the Medicare Advantage program. A Medicare supplement, or sometimes called Medigap, that plan covers what Medicare doesn't. So you have Medicare Part A, which covers hospital bills, Medicare Part B, which covers doctor's visits, and a Medicare supplement would pay anything that Parts A and Part B don't cover. And what we found is Parts A and Part B generally cover 80% of the cost. So a Medicare supplement is picking up that other 20%. The thing to remember about Medicare supplements is if you enroll in a Medicare supplement, you also need to enroll, or shouldn't think about enrolling in a Part D plan, a prescription drug plan, because Medicare supplements don't provide prescription drug coverage. First premiums due depends on the carrier that you enroll with. Some carriers require payment at the time of enrollment, so RightOpt may ask for your credit card or banking information so we can make the first payment with you. Some carriers will bill you directly for the first month's premium, so it really depends on which carrier you're working with. APR is auto premium reimbursement. That's a service that's offered by RightOpt. So we work with many of the carriers on our platform to set up a process where payments are made to the carrier for the premium, and then the carrier sends us a data file which we process through WageWorks so that the retiree is automatically reimbursed for the premium payments without having to submit any claims to WageWorks. So it takes the claim submission process out of the retiree's hands, and it's all done electronically. At the time of your plan enrollment, your advocate, your RightOpt advocate, will talk to you about APR, and if the carriers that you're enrolling with offer it, we'll ask if you want to sign up. So you'll sign up at the time of enrollment, or you can come back and call RightOpt any other time, and we'll sign you up for APR. You just need to call RightOpt, and we'll be able to look online and tell you if you're signed up for APR. So the best way to find out if you're enrolled is to just give RightOpt a call. We will send you a letter in the fall letting you know that the enrollment period is coming up and that you don't need to do anything if you're happy with the plans that you're in. In that letter, we'll also remind you that if you want to look at other plans to see what's available for the upcoming year, you can call us. So we'll reach out via a letter, but then if you want to look at plans or see what else is available, you call us.